Friends, as you all of know that we are talking about the 12 weeks certificate course in palliative care, and up to now we have discussed different aspects which you can provide as a caregiver. But now in this talk I'm going to discuss what are the health services the government of India is providing, and you can use them for your patient. Unless and until you have the proper knowledge of existing facilities being given by the government or by the NGOs, you cannot use it. So it is very important class. All of you should know from this class and also explore by yourself on Google these facilities which are being provided by the government. Government has taken a lot of steps. The state government and central government and NGOs all are active on this line. So let us talk one by one. So overview. Launched overview of a National Health Mission, NHM. NHM was launched in 2013. NRHM launched in 2005 and NUHM in 2013. What is this? National Rural Health Mission, National Urban Health Mission. These both are the part of the National Health Mission. Implemented by Vision, Ministry of Health and Family Welfare, Government of India, universal access to affordable, equitable and quality health care for all. This is the objective. Mission: strengthen the public's health system. Public means government health system, with an emphasis on preventive, promotive, curative and rehabilitative services, especially for poor people. This was the mission of National Health Mission. It was divided into two, Rural Health Mission and Urban Health Mission, because both have different kind of problem. Component of NHM, launch year 2005, the National Rural Health Mission, National Urban 2013, and target population, rural population, especially in underserved areas. Urban poor, especially in slums and vulnerable settlements. Focus area: maternal and child health, communicable diseases and health infrastructure. Urban primary health, non-communicable diseases, sanitation and slum health initiatives. Health facilities, sub-centers, primary health centers, community health centers, CSC, PSC and CSC. Urban primary health centers, UPSCs and UCSC. Key initiatives: ASHAs, mobile health units, Janani Suraksha Yojana. These are the parts of the National Health Mission. And outreach services, slum mapping, convergence with urban ULBs. This is the community involvement. Village Health Sanitation Committees, VHSC, Mahila Arogya Samiti, Urban Health and Nutrition Days. So the key features of National Health Mission and special focus on NCDs. Health infrastructure, strengthening the PSC, CSC, district hospitals and urban health centers. The government is giving fund for strengthening the infrastructure. Human resources, training and deployment of ASHAs, ANM, doctors, nurses and specialists on all these CSCs and PSCs. Human resources, training and deployment of the service delivery, mental health, palliative care, geriatric care. These are the main services which are being given. Drug and diagnosis. Free essential drugs are being distributed through PSCs and CSCs. Public monitoring, decentralized health planning is the community participation. And intersectional convergence, collaboration with sanitation, nutrition, education sector. The intersectoral convergence and health information, use of HMI's e-health card and dashboards for monitoring and decision making. So these are some of the important components of NHM: National Cancer Control, National Mental Health, National Diabetes Control, control of blindness, control and treatment of occupational diseases, control of diabetes, cardiovascular diseases, and stroke, and national program for prevention and control of deafness. They are the important part of the National Health Mission. The information about facilities in existing program of the health care which may be used by caregiver for palliative care. HWC and NPHC are the most accessible program at the community level. NPPC is nodal program for support and training in palliative care. Palliative care, since the course of palliative care, you can take access from NPPC. States like Kerala, Maharashtra, Karnataka, and Odisha have dedicated policies for palliative care program. But in the other states are also coming forward. But beside these states, the central government is also taking a lot of palliative care programs. Caregiver should inquire locally. You are a caregiver, you should inquire locally about the inclusion of palliative care under state health insurance schemes and contact CHOs for support. Many programs work in integration, e.g. cancer and TB program involving the NPPC trained personnel. So many programs are going on. They are also serving the requirement which you need as a palliative caregiver. So try to use the ongoing programs of the government for your patient. You know your patient is not a TB patient, he is not a cancer patient, but the programs which are going on is for elderly, for poor people, for the ladies, so they can also be registered in those programs if you make some effort for it. So relevance. Relevant schemes, program, services, benefit offered, and how caregiver can help patient and family to get the access of ongoing program. The primary health access, essential drug and pain relief, home-based care, referral and transport, and financial support for treatment. These are the components which can be utilized by you for your patient. How? Identify the nearest government facility, connect families with local ASHA and ANM for visit and follow-up. Essential drugs, coordinate with the district hospital or palliative care units to procure morphine, license, and maintain record. You can do it for your patient. Home-based care, help families register under NUHM Urban Slum Program or NHM Rural Care to get home visit services by the government staff. Call helpline for ambulance services. Pre-register the patient under chronic care through PSCs and UPSCs. So referral and transport will be easy for your patient. And financial, guide families to get Ayushman card via CSCs or hospital desks and help select impaneled hospitals. If you are a Ayushman card holder, the impaneled hospital will give you free service to your patient. So you have to get knowledge of all these facilities which are available in your area, and you have to connect your patient and their family members to these services. Then only you can have a better service of the patient. Family and mental health support component, training of caregivers, nutritional and palliative support for elderly, NGO trust collaboration, and public awareness. How to do it? How caregiver can help? Refer families to district mental health program team, and available at district hospitals. For family mental health problems, suppose a patient is suffering by Alzheimer, you connect the patient with this program. Encourage family members to enroll, build a skill, and end of the life care, medication, and emotional support. Trainings are organized by the government in hospital, district hospital. You encourage your patient family members to go and get trained so that they can give better service without burnout, without stress. Help families access urban PSCs or outreach camps for screening of elderly and chronic care. Most of the time, some camps are organized, some nutritional camps, palliative support for elderly. These programs are being organized periodically by the district hospitals, by the PSC, by the CSC. So if you have this information, you can help your patient and family members to go and get its benefit. And then last, contact district health officer or palliative NGOs to explore local tie-ups and inpatient support. So, and many NGOs are working in this line. Try to register your patient with these NGOs so that their services can be given to your patient and family. Lastly, public awareness and advocacy. Caregivers can distribute IEC materials, use audio-visual tools, and participate in local health services. The services offered, I told you, and these are the government schemes, and these are the components which you can arrange for your patient. Similarly, now I'm coming to the new program, National Program for Palliative Care, NPPC. I have discussed this term in the earlier slide, to provide accessible and affordable palliative care services. What are the headings? Target beneficiaries, key components, implementation, funding pattern, training coverage, key activities, role for caregiver, and support at the district level. These are the main things. The patient with cancer, HIV, AIDS, organ failure, chronic illness, elderly, they are the beneficiary of this program, NPPC, National Program for Palliative Care. Establish palliative care services at all levels of healthcare, district services. Availability of essential pain relief medicines you can get free of cost from under these services. Training you can get of healthcare professionals and caregivers, and integration with other national programs like NCD, NACP. These are the other programs which can also be made accessible to your patient under palliative care. Through state health societies under the National Health Mission, 100% central sector scheme, this is a central government scheme. Doctors, nurse, ANM, ASHA, MPWs and family caregivers, they are getting training coverage under this program. Key activities, setting up palliative care units in district hospitals. For this, fund will be given, palliative care center. Developing home-based palliative care. Awareness, the NGOs can get home-based palliative care. Awareness and community participation, and participating in training. Coordinate with PSCs and CHOs, facilitate home care, monitoring symptoms, and update HWC. So, dedicated district palliative care cells to coordinate services, training, and drug delivery. This is the very important part which the government is giving, and by bringing the awareness in the society, bringing the awareness with the family, and bringing yourself about knowledge of these facilities, you can give better service. Now, role of health and wellness centers in palliative care. Nowadays, wellness centers are being established in each district. 150,000 wellness centers have been announced by the government in 2019 or 2020. And these wellness centers, about 35,000 wellness centers are Ayush wellness centers, and rest is the modern medicine wellness center. Both are being established gradually in different districts, and they are the very good center for the screening, for the drug distribution, and for the local health care. So you locate the wellness center of your area and connect your patient with that center, so that all the facilities that government is giving can be delivered through that center to your patient. So early identification is primary objective, early identification. Continuity of care, pain symptom management, and home-based care support. These are the 4 objectives of the role of health and wellness center in palliative care. Role of HWC, organize regular health camp for screening of NCDs and need of palliative care. HWC will maintain longitudinal health record and follow. Now the many digital cards have been floated by the government. They are making record, longitudinal health record are being maintained, and follow up terminally ill patients. And HWC are trained to provide basic palliative care, including pain relief, that is the main problem, and refer to opiates necessity. They give you, this is a restricted drug you cannot buy, so these centers can arrange you, give you legally. And CHOs and MPWs conduct home visit for bedridden and end-of-life patients. How caregiver can get the hacks? Encourage patient to attend screening programs. Caregiver should update regularly. Request CHOs to manage pain, ensure referral to facilitate with morphine availability. Can schedule home visit by these officers. So these are the things you can do. And next, counseling services can be availed. Linkage to higher facilities like the district hospital or the referral hospitals can be arranged through the wellness center. Availability of essential medicine you can get, which is not easily available, like opiates, narcotic drugs. Health education and community awareness can be arranged by palliative care centers. The existing national health care programs in India. So I'm just giving you a list. National Program for Palliative Care, NPPC. National Program for Health Care for Elderly, NPHCE. National AIDS Control Program, NACP. National Tuberculosis Elimination Program, NTEP. National Health Policy 2017. Ayushman Bharat, Health and Wellness Centers, I told you. So palliative care component in all these programs are there. You must know main program dedicated to palliative care. This is the palliative care program. This is a geriatric care, including palliative care and rehabilitative services in this elderly services. And this AIDS control include palliative care for terminally HIV and AIDS patients, especially in late stage of the disease. In national tuberculosis include palliative care support for patients with MDR or XDR TB patients, post-treatment sequels. And the National Health Policy recognizes palliative care as an essential service under comprehensive health care for chronic, life-limiting illness. And Ayushman Bharat, as I told you, palliative care included as a comprehensive primary health care services under this. So these are the components which you need as a palliative care giver, and except one dedicated program, other programs are also there which can help your patient in getting the services. And this is also extended list of that. Pradhan Mantri Jan Arogya Yojana, PMJAY. This covers the secondary and tertiary hospitalization, some packages including palliative care interventions like oncology care. National Mental Health Program. This offers the psychological support which is integral to holistic palliative care for terminally ill, because most of the patients are having psychological issues. So that can be covered under this program. State palliative care policies, as I told you, some states like Kerala, Maharashtra, Karnataka, Odisha, they have a state program. They are very important. Institutionalization of palliative care through government health facilities, home-based care, and through NGOs. So these state governments are funding NGOs, home-based care, and other things. Chief Minister Comprehensive Health Insurance Scheme. Various states are having their own health insurance. Some schemes provide free cancer palliative care, pain relief, and home-based services. And the state cancer control program like Tamil Nadu, Punjab, Delhi, they are having cancer palliative care units supported in government hospitals and hospice. This is also, you can utilize these services. And palliative care under disaster and pandemic response like COVID-19. Guidelines issued to include symptoms relief and psychological palliative care in terminally COVID-19 infected patients. So you see, there are many programs which is already going on by the government in different names. If you have the knowledge of these programs, if you know how that can be made accessible to your patient, then you can reduce the financial burden of your patient, number one, and you can give better service through the government. You need not to pay for it, you need not to run physically, but you have just to inform the officer. A patient is with you, and the patient service giver, like a doctor, like a nurse, like an NGO, all are there in there, but they don't know each other. So your job is to connect both of them so that the services can be better and easily available to your patient. Now, National Program for Health Care for Elderly. I told you this is also one program. What are the key components of this for palliative care? Implementation, structure, palliative care linkage, service delivery, training and capacity building, and benefits for caregivers. The national program, chronic illness management like geriatrics clinic in PSCs and here going on, 10-bedded geriatric ward in district hospitals, physiotherapy and supportive services, home-based care for bedridden elderly, training of medical and paramedical staff in elderly care, National Institute of Aging, NIA, at AIMS, New Delhi, regional geriatric centers in select medical colleges, geriatric units in district hospitals, CSC and PSC. They are all available. These things are already in place. You have to just make utilization of these. Pain management, palliative care linkage, functional support, emotional care, and home visits, suitable for patients with dementia, cancer, frailty, and terminal illness. OPD and inpatient care, outreach services including home visits by ANM and ASHA, training provided by doctors, nurses, community health officials, and caregivers in geriatrics and palliative approaches. So these are the things which you can use for them. How caregiver can use NPS, National Program for Health Care and for Elderly, for palliative care need. Approach health and wellness center in your area and PSC that run geriatric clinic. Refer elderly patients with pain, immobility, terminal illness to these services. Request for home visit and physiotherapy for bedridden elderly. Participate in local caregiver awareness and training program. And coordinate with community health officer, CHO, for support in the end of the life. So these are the things you can do. So Ayushman Bharat Yojana 2018 has two components. Pradhan Mantri Jan Arogya Yojana and comprehensive primary health care through health and wellness center. Palliative care has been included as an expanded range of services along with health care of elderly. Support to families in palliative care and availability of basic pain management and palliative care services through wellness centers. And there is a provision to referral service also. So Ayushman Bharat Yojana can be utilized for your patient. Understanding Ayushman Bharat Yojana, I have already discussed it. I'm not going to talk again. Ayushman Bharat Health and Wellness Center, I've discussed in detail. Early teaching guidance for caregiver. Early identification. Encourage caregiver to use HWC Wellness Center for screening of chronic illness. Basic symptom control. HWC provides basic medicines for pain, constipation, nausea, free of cost. Use them for your patient. Take how to access them. Teach home follow-up. Trained caregivers to coordinate with ASHA and CHO to home visit. Mental health support. HWC offers counseling services also. Educate caregivers to refer families coping with terminal illness. Referrals. Guide caregivers on how to refer your patient from health and wellness center to higher center of specialized palliative care if required. Record keeping is very important. Caregiver can help patients maintain health diary to support continuing care. So, Rashtriya Swasthya Bima Yojana, this is also an important part. If you know about it, full name, launched by Ministry of Labor and Employment, 2008, target group, BPL, below poverty line, coverage amount 30,000 per family per year for hospitalization expenses, enrollment, smart card based biometric registration, premium contribution, government subsidized minimal cost to beneficiary, coverage type, secondary care, hospitalization only, up to 5 members per family. Status, now under Ayushman Bharat. It is now under Ayushman Bharat card. So you should know all these facilities, then you can give your patient. The central government health scheme, CGHS, the central government employees are registered under CGHS scheme. This is also very helpful. Launched in 1954, target group central government employees, pensioners, MPs, judges, certain PSU registries. Coverage type, comprehensive outpatient and inpatient care. Facilities available, allopathy, Ayurveda, homeopathy, and all these facilities are covered under CGHS scheme. Cited covered 70 plus cities in the India, cities covered. Services included consultation, hospitalization, diagnosis, specialist care, and palliative drugs. So through CGHS Wellness Center and impaneled hospital. So what you should know, ask about the government service history. Many elderly palliative patients may be eligible for CGHS scheme. Give them, connect them, inform caregiver that CGHS covers Ayush and pain management support. Caregiver can guide families to get free morphine and essential palliative drugs from CGHS. Train caregiver to assist families in navigating impaneled CGHS hospital in that area. Caregiver can help families maintain prescription and CGHS card updated for continuity. And caregiver emphasize CGHS availability in cities, refer rural patient to nearest CGHS linked facilities. These are the things which you should do for your patient for better services. Employees estate. This is another service for the Employees State Insurance ESI scheme. The Employees State Insurance scheme, Ministry of Labour has launched it. Workers in organized sector earning 21,000 per month or less salary, they are registered for this. Medical, maternity, disability, and dependent benefits are given. Free medical care, OPD and IPD, for diagnosis, rehabilitation, and cancer care. Sickness benefits, maternity leave, disability pension, and funeral benefits. And ESI hospitals, dispensaries, and in-paneled private hospitals are facility covered. And contribution-based employer plus employee. So funding is done, and for the employees who are salary is less than 21,000 per month are eligible for this kind of service. So you inquire if the patient or family member was an ESI covered worker to determine the benefit. Inform families that cancer, renal disease, which is very common nowadays, stroke, rehabilitation, etc., are covered under ESI. If your patient is having all these things and he is ESI registered, you can leverage the benefit of ESI scheme to your patient. No local ESI hospitals and refer eligible patient for long-term treatment. Assist families with documentation. You have to do good documentation for claiming disability and dependent pension. Caregiver should help spread awareness of lifelong benefits available even after retirement. So work with ESI Social Security Officer for continuity of care in terminally ill cases. These are the things you can give to your patient. National Health Mission, role of palliative care, I told you. National Health, NHM, it was launched in 2005. And now it has the two components, Ministry of Health and Welfare, State ASHA. Janani Suraksha Yojana ensures the safety of motherhood. Motherhood, assist in ensuring all documents, BPL card, ID proof are ready for JSY benefits. Support newborn care, maternity recovery at home, especially in palliative households. Teach caregiver how to console families about the benefits, counsel the families about the benefits and safety of institutional birth. So birth should be in the hospital. If the birth is in the hospital, all these facilities are extended to him. So now try to convince the family, the pregnant lady, to go to the hospital for their delivery, not to stay back at their home. And if they go to the hospital, all these facilities, Janani Suraksha Yojana, which is government has launched in 2005, can be given to the patient, especially the pregnant women, especially for BPL and SC/ST group are beneficiary of this Yojana. It's very nice. Many people are deprived of these facilities. They can be given 700 to 1400 depending on the state category, low or high performing. Pregnant women age 19 plus from BPL household up to 2 live births, they can get this benefit, eligibility. This disbursement, direct cash transfer, post-institutional delivery. Institutional delivery is the essential part of this. So, Pradhan Mantri Suraksha Matritva Abhiyan, ensuring maternal health again. This is also a very good thing. Mission Indradhanush, ensuring universal immunization. Immunization is a very important challenge for the Indian condition. And this was the mission Indradhanush, was launched by Ministry of Health and Family Welfare. Children under 2 years and pregnant women are target groups. Objective to ensure 90% immunization coverage for vaccine preventable diseases. Vaccine focus, vaccines for diseases such as polio, diphtheria, tetanus, tuberculosis, hepatitis B, and others. They are covered in this. Implementation area, focus on underserved area, including remote and tribal regions. Frequency, special immunization drive for unvaccinated children and pregnant women. It reduces the morbidity and mortality from vaccine preventable diseases. So in case of immunization complications or side effects, caregivers should refer to healthcare professionals again. So vulnerable palliative patients, this is also very important, you should know. And affordable medicines for palliative care. Pradhan Mantri Bharatiya Jan Aushadhi Prayojana. This is also Ministry of Chemical and Fertilizer. In Ministry of Chemical and Fertilizer, Government of India has launched this program and offer high quality generic medicines at low cost to the public. Available over 7,000 Jan Aushadhi Kendra across the country. So it includes the essential medicines such as the painkillers, antibiotics, cancer drugs, insulin, morphine, alternatives, and generic medicines available 50 to 90% lower cost than the branded medicine. So Jan Aushadhi Kendra is a very important step taken by the Government of India for taking the medicine at a cheap, affordable cost, because the branded medicines are very expensive and the people are not able to buy it. And these are the diseases which are lifelong diseases. So the medication is also lifelong. So out of the pocket expenditure should be controlled as much as possible. So Jan Aushadhi Kendra is helping to reduce the financial burden of the patient as much as the caregiver can refer families to Jan Aushadhi Kendra for affordable options, making treatment more accessible for the financial standard of the family. So PM Ayushman Bharat Health Infrastructure Mission is another program going on. So key role of caregiver, I'm just summarizing it: observe and communicator, report changes to CHO, facilitator, ensure access to services and medicines which is already available by the government program, support providers, manage daily care and hygiene comfort, and licensing, bridge the clinical team of wellness center and home care needs. So this is the main role which you can give for your patient. With these words, I extend my sincere thanks for your patient listening.